Good afternoon, everybody. Thanks for joining us today. So you're here to see a revolutionary liposuction procedure, and I'll explain that briefly and then introduce you right to the host. I first have to do a disclosure, Top Doctor Platform Disclosure, it's called. The Top Doctor Platform is designed to bring interesting, relevant, and cutting-edge educational webinars to medical professionals. Top Doctor, the platform, does not participate in any profits from the sale of products. The webinar presenter or the manufacturer of the products may direct you to authorized distributors if you have further interest. That's a pretty short one, right? All right, so I want to introduce everybody here to James Finnegan. And James is the CEO of, I believe it's called Inspiring Physicians, and they represent, I think they have exclusive rights to a company called Fun Sculpting. It's kind of a crazy name, but we'll go over the technology here in a second, and you'll understand why this is pretty cutting edge. So it is a real cutting edge liposuction technology, and I know everybody and their brother and their sister, and especially people in the medical business, have heard about liposuction horror stories, you know, weeks to months. I even heard of a mommy makeover where it's been a year and a half and the young lady is still sore. So what this does, the tech uses, I believe they call it a harmonious or harmonic wave. He'll explain it to you in great detail. And what that does is it kind of separates the nerve endings from the fat. And so when the actual removal of fat happens, it doesn't cause all this, you know, irritation and inflammation and pain. So what happens then is the typical person is back to work right away, walking the next day. They actually encourage you to go walking the next day, and most of the inflammation in most cases, I believe, is gone in 3 days or less. Now, they're going to explain it to you. I'm just giving you the intro. It eliminates most of the need for tummy tucks, which is really cool, and loose skin. A lot of times when you get lipo, as most people know, or if you don't know, I'll explain it to you, and you have some extra fat, that fat droops over. So you a lot of times have to cut them. So another surgery, more pain, etc. So it also tends to bring out the abs, which is really kind of a cool benefit. And the rate of return on the investment is just as fantastic as anything else, or just as impressive. I mean, it seems to be 7 to 10 times, and they can tell me if I'm wrong. You know, when the average procedure is $5,000 to $8,000, and it's taking you an hour and a half, and the lease payment is in the $3,000 range. And what's cool right now with all the stuff going on, and I know there's a lot of negative with coronavirus, and they have companies now out there that will actually extend lease payments for 12 months. What that means is no payments for 12 months. So let's not get into the financial side. That's all different. That's not what we're here to do. We want you to see the technology, and you'll understand why we are so impressed with it. And by the way, you don't have to be a classically trained plastic surgeon or a dermatologist or the person that traditionally does lipo. You can train a mid-level, such as a nurse practitioner or a PA, to assist in this procedure, or completely do it depending on the legalities of your state. Make sure you check that out, because that's not what we do. I just want to tell everybody this is probably as impressive, or the most impressive, not as, a piece of cosmetic medical breakthrough equipment I've seen. And, you know, I was around for the beginning of a Y-lift, which I thought was really cool, of surgery-less facelift. You know, this is probably more impressive. So without further ado, everybody, James Finnegan, CEO, and he's going to talk all about this new liposuction tech. You ready, James?
He says he's on, but he can't be heard. He's having a hard time. Can you hear me now, Vince?
I can hear you
yes.
Great.
Okay, so I'm JF on there, or user number 33, but as long as you guys can hear me now, we can go ahead and get started. Can everyone see my screen?
Yes, sir.
I believe everybody can see your screen. I can see it, so.
Yes. Okay, great. Let's go ahead and get started then, if you guys can hear me. And hopefully we'll save some time after this. This is about a 15 to 25-minute presentation to introduce you to the latest advancement in fun sculpting. Vince did a great introduction. We are actually the manufacturer of the product Fun Sculpting out of Inspiring Physicians Worldwide out of Scottsdale. And we do distribute this exciting technology. And we're going to talk about what makes it so unique. We're going to talk about some of the key things, especially during this time where everybody's trying to get, find cash infusion procedures. And we're going to jump right into it. I've been in the industry now for well over 25 years. I've been involved with a high-level group of people that have constantly said, James, how do you know which technology is the right technology? How do you know which one's the wrong one? And I always say if these 5 key things line up, then it's the right investment because it'll return an incredible amount of revenues. If any one of those 5 things falls out when you're vetting equipment and trying to figure out how do we get new revenues into the practice, it truly becomes an expense. So I'll run through this very quickly. Number 1, it has to be cutting edge and new to market. Number 2, it has to be a high demand procedure, meaning if you went up to Nordstrom, showed someone the before and after photos, or even Target or Walmart, 8 out of 10 of those individuals should say, wow, that's impressive, I'm interested in that. Number 3, it has to be a high revenue generating. What we mean is it has to generate $3,500, which would be a chin treatment, on up to $7,000 a treatment, which would be an upper and lower abs flanks and a breast augmentation or a natural Brazilian butt lift. Number 4, it has to have superior business development training and marketing. So the clinical training has to be far superior. And physicians have to be supported clinically so they can get the exact same results that we're about to show you right now. And then the last one is most important is the technology sound and reliable. We're the only manufacturer that offers a 2-year unlimited warranty from software and all upgrades. So what that means is we're not going to come out 6 months later and go, ta-da, now there's a software upgrade. It's actually included for the first 2 years. So if those line up, those 5 things line up, then the equipment becomes an investment and not an expense. And if those of you that are on the line, if you wouldn't mind muting your phones, and then we'll invite you to unmute after we're done in about 15 minutes. So part of the strategy behind the program is teaching you how to do advanced marketing events where you're educating people in a real intimate group, and you're just explaining what the procedure is all about. And like we said before, because it's a high-demand procedure, 8 out of 10 people get excited and then sign up. So it's over 500 systems nationwide, and every single one of them has been profitable by month 1. Why is that important? Most medical device companies have between a 5 to 15% fail rate. We have a 0% fail rate. We haven't had a physician fail. And there's a reason behind that. We'll talk about it, but the business development training, and what's included is we're here to coach you on the business side as well as the clinical side. We give you all your consent forms, all the intraoperative things that you would need, post-care instructions and everything. So it's a turnkey solution. This is one of the only solutions where we do a billboard for you near your location, web marketing by virtue of Facebook and Google AdWords and so forth, where we create this customized marketing plan for your office and drive it very hard to you. So on the business side, you can have the best technology in the world. If you don't have a company that's locking arms with you to help you move forward in presenting the message, it could be a long glide path. So a lot of doctors
James,
will say,
would you mind if I point out something real quick that I'm supposed to point out on these calls now? So everybody knows this equipment is FDA approved. Correct, James?
Yes, and by the way, yeah, you're not allowed to sell anything for medical procedures is not FDA approved unless someone wants to have a felony. It's a pretty big deal if someone markets without FDA approval in North America anyhow. So yes,
and one of the other things
FDA approved.
One of the other things I want to point out, one of the other reasons why I was so impressed with the equipment, the company actually will probably spend more money than it would cost you more money to spend on marketing than what your probably payment would be to get that kind of advertising. And that's really impressive. Absolutely. Because very few companies do that. Because they know that you're going to succeed, and they're probably, at some point, you're going to say, stop advertising because we have customers coming in, right?
Absolutely. That's exactly right. And that first 3 to 6 months is critical to get your name recognition out there so that the revenues start flowing. And to Vince's point, this is all about getting that return and recharging all of our practices. We know the reimbursements continue to come down, and they're never going back up, as we constantly see. So keep that in mind, that all those patients you've seen in the past are literally a phenomenal relationship database to go back and sign those individuals up when we do educational events, and we'll teach you how to do those. But it's very intimate. It's 8 to 10 people. They come into the practice. We educate them on what we're doing. Get to see them again because a lot of them have changed formularies, so they're with different groups, and it's an incredible opportunity. So Albert Einstein has a quote, "Necessity is the mother of all invention." Back in 2004, Doctor got in a crash on the Autobahn. Why this is significant is he went to some engineers and said, hey, can you create a product that would allow my hand to move at the same movement because I've lost some of my fine motor skills due to some injury in the back? And they went through several different types of motors, and they found if there was a gold and titanium motor it would create a rocking effect inside the handpiece, which would create an amplitude. So just to do a freeze frame really quick right here, many of you know that 99.9% of all physicians out there in the market use traditional lipo. That was invented in 1986. Dr. Klein kind of outlined the tumescent solution guide, who is a dermatologist. Plastics and anyone in aesthetics has been following Dr. Jeffrey Klein, who's a dermatologist. So body contouring in general has been considered an aseptic dermatological procedure. However, if you look at the success rate that doctors have had with traditional lipo, many of them will tell you, I don't even like it. A patient typically has to be either heavy IV sedation or general sedation. I don't like doing it. It takes a lot of time. Then they came out with this great idea called lasers, which is the latest attempt to secure extra revenue. The name sounded great, but the results were horrible. That's why if you type on smart lipo, iLipo, cool lipo, you'll see tons of use. Laser systems. And then there's traditional lipo. Traditional, laser, and then ultrasonic. Ultrasonic lyses the fat cells. Laser started off 20 years ago saying, look, we liquefy the fat cells. Then they came out and said, well, maybe we can use them again, and found out there was only a 10% viability. And so for the last 20 years, you've got traditional, you've got lasers, and you've got ultrasound. But there really hasn't been anything that really changed the market share like Fun Sculpting brand has. And what we're going to talk about now, and to go into the science behind what makes it so unique, is whether you've ever purchased an aesthetic piece of equipment or not, this is revolutionary for the number one reason that doctors across the board have purchased it. We've never had one death with Fun Sculpting, whether we've done fat transfer to the breast or Brazilian butt lift. And the reason why is there's an amplitude. When there's an amplitude at the tip of this micro instrument that goes underneath the skin, it's an aseptic dermatological procedure. It's done in a standard 8x8 treatment room. The value is it's going up and down, side to side, and back and forth. The only other devices out there are ram and jam systems such as PowerX that are rotating, or you've got PAL systems which are electric motivating, which are reciprocal in one direction in and out. It's just a traditional lipo system on steroids. Amplitudes and adjustable amplitudes are completely different than any vibrating technology. So it's vibrating, amplitude-assisted body sculpting, and we're going to get into this. But a doctor said, hey, how good am I going to do with this procedure? 7 days post-operatively, very, very little bruising. This is actually me. As James, my name's James Finnegan, CEO and founder of the company. People would constantly say, have you had this treatment done? And we were running so fast when our product hit the market 4.5 years ago. I didn't have time until about 1.5 years ago, and I'm like, listen, I'm getting this done. Now, having grown up playing sports, we start traveling a little more. Metabolism slows down in our 40s. And this is the middle photo is immediately after, and the next photo on the right is 24 hours after. So significant circumferential reduction. This is the only device that's FDA approved for 2 to 5 inches of circumferential reduction, guaranteed. So you can say that in your ads. There's no BMI restrictions. The benefit of that is it's not like a cool sculpting or sculpture or some of the non-invasives where their BMI limitation is 26. You're going to see in some of these before and after photos, we can treat all different types of patients. We've had doctors that have done aesthetics that have said there's no way you can get these types of results day 2. The only way you can get these types of results is with an amplitude that's designed not to disrupt all the connective tissue and cause massive trauma, and selectively targets the adipose tissue. So 12 hours after and 2 days after, just incredible dynamic results. So this is a general practitioner that had never performed even real injections. Most of the practice was spent doing prescriptions, and the doctor said, are you sure I can pull this off to a high degree of certainty? It's very, very simple to move through this. So since 2016, aesthetics has really been on the top of the scale when it comes to the sector most poised for growth in the medical side of the industry. And so when you look at it, it's the number one most commonly performed surgical procedure for men because men want the six-pack, and for women, number 1 has been natural breast augmentations, number 2 has been Brazilian butt lifts, and then there's, obviously aesthetic procedures as well. But this truly has grown to a $50 billion industry in aesthetics. So why is this so important is we can transform a procedure that once had to be done under IV and general sedation now into an in-office setting. I'd encourage any of you to go online if you're wondering, how is this done? You'll see my procedure done if you type in Fun Sculpting on YouTube. From start to finish, it's about 1.5 hours. And I haven't regretted having the procedure done one day. It's been phenomenal. And most people say, well, if you can do it, I can, because it's true, men typically have a lower pain tolerance. But here's the unique slide that you have up here. The adipose tissue is very yellow. There's no floating tissue. There's no floating fascia, which is the connective tissue, nerve endings, or blood vessels like you see with any of the other modalities. There's no necrosis of the adipose tissue. Why is that an aha moment? That's what gives us a high cell viability when we do fat transfer to the breast or the Brazilian butt lift. And we know that we're 85 to 95% cell viability. There has not been one competitor that's been able to compare on that usability scale from patient satisfaction. We even have some physicians that are reporting 100%, viability, which is incredible, because the less trauma you have to the adipose tissue, the less dead structures floating in it caused by actually taking the adipose tissue out, the higher the cell viability. So let's go into the science behind what's happening. There's two modes and mechanisms of action. Number one is when the amplitude's whipping and it's taking out a high level of stem cells in the adipose tissue. That's one facet of it, but it's also insulting a 350 microvasculature bed that releases a cytokine in the surrounding tissue, and that stimulates fibroblast activity. That's 50% of the tightening that you see. The other 50%, and hopefully you can see this endoscopy shot in the middle, that's actually a tip of our cannula. As it's whipping, it's not cutting the nerves, it's not cutting the fascia, it's not destroying the blood vessels. So you're not seeing significant bruising as a result of the procedure. You're seeing great connective tissue. The reason we're doing open dissection for that breast reduction of the abdomen, no other device out there causes less trauma to the tissue than with amplitude-assisted body contouring. And then we have physicians say, okay, wait, I watched your procedure, I see you're texting. Did you have an IV in or something? Were you really heavily sedated? The answer to that is no. You're completely awake, you're watching Netflix or whatever you want to watch, you're talking to the office staff, or you could even put eyewear on. But one of the secrets behind this is the vibration works in the same theory as the gate control theory of pain. And many of you know that diffuse oxygen inhibitory control theory, like the 10 system for pain management. Some of you used it for, back pain or what have you. But as the area is numb with tumescent solution, which is lidocaine, saline, and epinephrine, as the whipping effect is moving through the tissue, there may be a little sensory nerve that gets hit by the tip of that cannula. But what's interesting is because it works in the same frequency as that 10 system for the gate control theory of pain, that painful stimuli that tries to ascend to the brain is distracted by that vibration. And we see an endorphin spike that remains in the bloodstream for up to 36 hours after the procedure. So here's the great news. Not only are we not given IV sedation, no general sedation, no narcotics are prescribed after the procedure. This is really, really important, especially with the opiate controls that are happening in every single state. And it tells you two things. Number one, if the patient doesn't need narcotics, it shows that there's less trauma to the area. But here's the great news for all providers on the phone. Less calls, less issues from patients going, hey, I don't have tons of pain. I can get out the next day. Our biggest problem, just so everyone knows on the phone, is patients don't realize that they have had a procedure done. They'll typically overdo it more than they should, and they will end up drinking more alcohol than they should. And those are things that we write into the post-care instructions because they still have had a procedure done. But we're gonna talk about the value of having the patient alert during a procedure. Is they can stand up in the middle of the procedure and say, hey, doctor, or mid-level, nurse practitioners, PAs, can you take a little more out of here? Can you do a little bit more here? So they're actually an active participant in these procedures. So you can see upper and lower abs, medial, lateral flanks. This right here is about a $9,000 treatment. This is a patient who had upper and lower abs and medial lateral thighs. So let's kind of go through the pricing because I think this is important. So imagine if you had two hands in the upper abs, that's considered one area. Two handfuls is one area. So the upper abs would be $2,500, the lower abs would be another $1,500, and then the flanks would be an additional $1,500. So $2,500 for the first area, upper abs, plus $1,500 for the lower abs. That's $4,000 total. Then $1,500 for the flanks. That's an additional $1,500. So that's $5,500 for that three-area treatment. And then you would do an inner and outer thigh, and that would be roughly another two areas. On a small patient, someone might reduce it down a little bit more and only charge $1,500 for that inner and outer thigh. So the total charge for this case would be about $7,000, and that would take about 2 to 2.5 hours of treatment time in a regular exam room, 8x8 exam room. So there's no need to go out and create this huge surgery center or do anything like that because it's considered an aseptic dermatological procedure. So here's a patient who had 3 sessions. Here's what happened with the patient. Came in for the upper and lower abs, then noticed the flanks and the brow fat area look accentuated, and then came in for a 3rd area. Now the good news is, and this is 90 days post her 3rd treatment, if a patient was in a lot of pain, there's no way they would sign up for a 2nd or 3rd treatment. So that kind of telegraphs, hey, wait a second, they're very comfortable. And quite often, most of our patients do come back for secondary and tertiary treatment. So here's 3 sessions. This is a patient who was told, you're too fat, go out and lose some weight and then come back and we'll see what you can do. This is the same patient that was worried about having IV or general sedation, read about Joan Rivers going in for a routine endoscope treatment or just a scope and didn't come out. So the patient came in, doctor did a treatment, 2 to 5 inches off. The next treatment, 2 to 5 inches off as well. Now, the New England Journal of Medicine and a lot of doctors in Europe have published papers and have said, whoa, 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 everything has changed in the last 5 years. We used to tell patients, go lose 50 pounds. And now we've learned through obesity disorder, the hormones that are released from the adipose tissue have caused almost a resistance for the body to lose weight. Now they've discovered you have cardiovascular function improvement, A1C levels drop, and triglyceride counts drop. So we see an incredible overall health benefit of these patients that are really large.
So wait. So you mean that this may have a positive effect on diabetes, and if you're saying what you're saying, it could actually reduce the reduce insulin levels needed.
Absolutely.
I don't want to make a claim, but I'm just guessing.
No, there's over 12 studies written by physicians in Europe proving that when you decrease the adipose tissue and the pancreas and how hard it has to work to support the individual cells, just by physically taking those adipose cells away, you're thereby reducing the effects and the tax load that's on the pancreas itself. That's documented on
right, because it's called VAT, visceral adipose tissue. It actually your body doesn't know where the excess fat goes, so a lot of times it puts it there because it codes and protects the organs. So that would be reduced in the liposuction procedure.
Yeah, the subcutaneous fat is reduced, but the visceral fat is not, right? So the fat that you can grab a hold of, it will take away. Now, doctors in the U.S. have petitioned the FDA to say, wait a minute, we've seen the metabolic rates improve as a result of this. People's activities naturally improve. We'd like to show 90 days and 365 days. The FDA has refuted that and said, absolutely not. We're only going to do 90 days because that's showing what the true device can do. And the main reason for that is Blue Cross Blue Shield, Aetna, all the big dogs, they don't want to ever have to go out and pay and reimburse any medical professional for performing body sculpting because there are true health benefits and it's all recognized throughout Europe and Asia. But to keep going on, this is a patient, look at the significant skin tightening. Now, you'll still see a protrusion or a distension of the abdomen. That's visceral fat. So once again, we can only treat the subcutaneous fat, the fat that you can pinch. But this is also a patient where they told her, you know what, go lose 50 pounds, or you get to have a hip-to-hip scar if we're going to do a full abdominoplasty, which is often what happens to these patients. But we get incredible skin retraction. So why are we seeing such high skin level retraction? I want you to remember back from the endoscopy shots that we had shown where the adipose tissue is gone and you just see white, that fascia, that connective tissue is still there. It looks like white rubber bands still in place. When the patient wears a compression garment about 2 weeks, both day and night after the procedure, that skin really, really tightens up without any heat or disruption. That's why, as you can see here on this patient slide, this is an African-American patient. We have no risk of disrupting the melanin. This is a big aha moment for most physicians that have dealt with lasers or ultrasonic devices that actually disrupt the melanocytes and cause hypopigmentation, which is a permanent condition. And that's a real risk for those that have used those. Now, if you live in areas that are predominantly Caucasian, then you don't need to worry about that. Lasers and ultrasounds and heat-generating devices may work if you're just treating Caucasians. But most of the areas that we're at are very diversified. Here's a patient that just did upper and lower abs and a little bit of saddlebags. That's about a $7,000 treatment. More bra fat area and flanks and the medial lateral thighs. Now, you might think about this patient here. What would this patient need? Her BMI is well below 26, but literally wanted to get in her skinny jeans. So this is an inner and outer thigh. So let's go through the pricing again. So the inner thigh would be 2 hands. The outer thigh would be another 2 hands. So the first area is $2,500. The second area would be another $1,500. So this would be a $4,000 treatment. And this is roughly about a 45-minute procedure for $4,000 of a treatment. Once again, they're talking to you. Sometimes they'll even, put their headphones on and totally zone out while they're having the treatment done. And it's quite an enjoyable experience. We've had physicians from all different sectors. We've had cardiologists, vascular surgeons, ER doctors, GPs, dermatologists. That we have had this spectrum of physicians, internal medicine doctors say, look, I actually got flowers from this patient. I haven't had flowers in forever of someone saying, thank you for taking care of me. I'm so excited. So we created a national trademark, and it's called It's Not About Vanity, It's About Confidence. Because when you visit with these patients one-on-one and they say, my confidence level has changed so much, we might think, oh, what's the big deal, the girl that wanted to fit into her skinny jeans? But it really changes the way that they feel. Maybe their mother had said at some point in time, you just have a little bit of chub on your navel area, and that bothers them, even when it was said at the age of 8. And so the goal is to take care of the area that the patient wants most. Underarms, we can get nice 2 inches, up to 2 inches of retraction. So if someone has real thin skin, they're not the best candidate, but if you can pinch fat, then they're excellent because we get that skin retraction due to the fibroblast activities. Submental incision, this is a $3,500 treatment that takes 15 minutes. And yes, it's much better than Kybella or anything else that you would do on the market because it is permanent removal of the adipose tissue. And we're not removing 100% of it, we're removing about 80% of it, but it completely redefines the jawline. So physicians have submitted photos, and what they do when they say, hey, look, I want to do high abdominal etching, what we're in essence doing is we're taking a high volume of those fat cells out. And when we take that high volume of fat cells out, why that's kind of important to understand is that not only are we taking the fat cells out, we're skeletalizing the area. This is another big aha moment because the dogma when we were taught about traditional lipo or with lasers or ultrasounds, if you take more than 2 centimeters, you'll cause skin necrosis because it's destroying and ripping all structures. Not so with fun sculpting. That amplitude protects all the blood vessels. So as you're going under the skin, we can actually skeletalize it and show. So every one of us on the phone has a six-pack. Just some of ours, you can't see it. So the good news is it's incredibly rewarding. All of these patients that come in, now we have opened up the portal for men having these treatments done, going, wow, I feel way more comfortable with my shirt off. I'm one of those individuals. I would play basketball, and if I missed my free throws and became a skin, I would say, you know what, guys, I got to run to a meeting. I didn't want to be the guy running down the court with the man boobs. And so every one of us on the phone can identify with one person that you see in these before and after photos and thinks, you know what, I think I might be a good candidate because it changes the way you feel. So how much do we charge typically for a fat transfer? It really is up to you. All this pricing we give you is standard. Most of our providers say, you know what, we're following your plan to a T. We want to generate, like Vince said, 10 times the return on investment. The lease payment's around $4,000 a month. So imagine if you did a case that had upper and lower abs and flanks and a breast dog like this next patient here. This is roughly a $7,000 treatment. So if the lease payment's $4,000 on this, even one procedure in a month, you literally have netted, close to $3,000. So it's exciting to see where the procedure is. So this is upper and lower abs, flanks, and a natural breast augmentation. This is upper and lower flanks and a Brazilian butt lift, which is one little incision in the buttock area, and more breast augmentation. So what happens when you're doing these procedures is you have the patient sit up and say, what do you think? Should we add more? Where would you like more added? This doesn't happen in typical cosmetic procedures where someone gets knocked out and they just pray that the doctor did exactly what they wanted or that they could somehow read their mind and guess what the end result could be. That doesn't have to happen with this. We can have patients say, can you take a little bit more out of here? Can you take a little bit, wait, can you add a little bit more up here? And this patient had upper and lower abs with flanks and medial lateral thighs and a Brazilian butt lift. So this is basically about a $10,000 treatment. Here's another patient that just did upper and lower abs, flanks, and a breast.
So quickly, how long did that $10,000 treatment take? An hour and a half, 2 hours?
Yeah, so basically think about every area is 30 minutes. So upper abs would take 30 minutes, lower abs would take 30 minutes, flanks would take another 30 minutes, and then a breast dog takes about 30 minutes. So this total procedure time is 2 hours, and this is for $7,000. Now for this last treatment, where someone is, hold on one second, where this one patient treatment did upper and lower abs, flanks, and medial lateral thighs, and a booty for $10,000, that's roughly about a 3-hour treatment. But incredible when you look at the time ratio. Remember, we talked about how much is your time worth. You have to make sure that you're netting, you know, between 1,000 to 2,000 and sometimes up to 5,000 an hour, and that's where the true revenues start flowing into practice. I hear doctors say, well, this rep came by and said I should start doing laser hair removal. And I say, okay, let's look at hair removal. Let's look at the price. Let's talk about the laser technician. By the time they're done, they have to do almost 15,000 to 20,000 just to break even. The numbers aren't even close with this. So here's a patient who says, look, I want it to look more like an implant. You can see the benefit is you can put more fat medially, like right to the midline in the chest, instead of an augmentation with saline or or silicone. They typically put it under the muscle and they lay lateral, so there's a huge gap. With this, it actually looks way more natural, and it's also a big benefit when we're doing mammograms. You can see right through regular fat and do biopsies as normal if you see anything suspicious. So you see the autoimmune and hypersensitive response patients have had. It's really caused a lot of our physicians to get involved. And when patients say, wait a minute, explain to me, why did you decide to get involved with this? Well, you're not a plastic surgeon or you're not a dermatologist. Why did you decide to do this? And the doctors have said, you know what, I waited until the technology finally advanced where I could see great results for our patients as well as low complications. And this is an aseptic dermatological procedure, and 99.9% of plastics do not offer this. They would rather offer 1986 technology. So guess what? They call the plastic. You have fun sculpting, and out of 500 systems, there's only 12 plastics. So you're talking less than 0.5% of plastics that have bought the system out of just the ones that have sold. And the plastics have said, James, I want to knock the patient out. I don't even want to talk to the patient. Number 2, I hate lipo. Number 3, 33% of my lipo cases I have to do a retreat. And that is exactly true with traditional lipo. So the results speak for themselves. Jumping into the return on investment, I won't take much time and we'll open it up to the general body of participants. But we talked about with just doing one treatment, you can make the payment pretty easy. And I think that's why we haven't had doctors fail. We boost the marketing program, and here's what typically happens. If everybody says, James, please tell us, the CEO, what's the worst case scenario you've seen with the marketing program, everything you do? These are doctors who have had not even existing patients. We always see 4, 6, 8. So the first month we do 4 procedures, which is about 20,000 plus a month in revenues, which is over $250,000 a year. Second month we see 6 procedures, and this is from our lowest performing doctors, and that's pumping in about 30,000 in new revenues in a month. And the third scenario is by the third month we've always seen 8 cases. Now, have we seen some doctors when they pump the marketing program exactly like we instruct and we say, here's what we're doing? We're not going to tell you guys where to put the billboard. We'll say, tell us, you know your area a lot better. We have the relationship with these groups, but tell us which one works best for you. Which patients do you think are going to be the highest and most impacted? And that's the difference. And so I parlay that and say, is there any other technology out there that can generate these types of cash revenues? And thank goodness there is no reimbursement. This is all cash-based, meaning there's care credit, there's enhanced patient financing, there's Paracel, there's third-party vendors that finance our patients, so we get paid up front. We might take a slight discount of 5%, but we get our cash up front and a third party takes those payments. So, when I've had doctors that have said, James, I can't even get a $5 copay out of somebody, the good news is the value of those patients, they have no problem paying for aesthetic procedures. And even in an economic downturn, we continue to see growth and continue to see our physicians are moving into a cash-based plan because that is answering a lot of the questions. So let's go ahead and open it up to the general body.
James, we got a really good question already on the chat. Okay.
Yeah.
And
sure.
Can you go over how the training works? They're asking how you provide training.
Excellent. Yes, thanks for asking that. And I can't see the chat window, so thanks for reading that out.
That's viewer 23 or 32.
Okay, great. Thank you. Thank you so much. So the training works like this. We have training centers throughout the U.S. We typically pair our providers up with similar providers. So let's say if there's a general practitioner on the phone saying, hey, I want to get trained by someone like me. We have them fly into that center and get trained for 2 cases. Sometimes it's a case one day, and sometimes it's a second case the next day. But it's a full immersion program where you're hands in with the other provider. You're doing the procedure. You're doing the pre-op where you're talking to the patient. You're going through the consent forms, and we provide all that for you. But before you even go to the training center, there's about 8 videos that we've recorded so that you can watch the videos online, learn how to do it, just get a kind of an overview. Then when you go hands-on, you're doing 2 hands-on cases. And I tell everybody you're about 80% there after you've gone through the independent study and you've actually gone through the didactic portion, because we have a textbook with several required chapters that we want to read before you come to the training center. Then you watch the 8 videos. Then when you come for 2 days of instruction, that proctor is there for you. Literally, it's been indefinite. We say for the first year, but literally we've had doctors that have been going for 3 years, and they still call their training provider saying, hey, I got this case with a patient that, is stage 4 cancer. What would you do? And the training doctor says, I'd call the oncologist and ask for a prior auth before I'd touch that patient, So you always have that backstop, but here's where the magic comes. So you're 80% of the way there. Where the 20% comes is we send a proctor out to help you for 4 live cases at your facility. This could be office staff. It could be family or friends. But you actually have hands-on with your own family. So you get to your 20% very quickly. The proctor's there to watch you, make sure you're very comfortable. But then here's where the magic really happens. When your patients come back in a week or 2 weeks later, and you're like, wait a minute, I did that. I can do this. And you realize the learning curve is very short, and you're overexposed. We've had some doctors go to the training center and say, do I have to watch 2 cases? This isn't that hard. Or we've had some people, we book out 4 cases at your facility, and by the first case, they're like, look, I could do this all day. It's easy. And we say, well, we're still going to stand by and just make sure there's no questions. But we want you to have treated every single area by the time we've gone from from your initial training to your final training at your facility, so you're absolutely comfortable with the whole procedure. But that's a really great question. There's no company that offers such extensive training, but we believe if you have superior training and support, that's what allows you to continue to get good results. If you go watch a live Saturday case and then you get home and you have a machine sitting there, we don't believe that's in the best interest of you or us as a company or the brand overall. So it's a really, really great question.
I got a follow-up question to that same question from a different person. So the training is live at their office, but there's a training before that. Is that training, do they come to your facility or the very first training?
No, so the first training it's all independent study, so it's all online. So there's several required chapters. Yeah, it's a didactic thing, so you just go on. A lot of doctors literally go through it on their way to wherever the training center is on the plane, and then they come in, and the doctor from the training center, so you fly to their training center, but then we have someone fly out to your facility when the machine arrives and does your hands-on additional proctoring with your own patients. So it's not a watch one, do one, teach one. Here's how it is. It's watch 8 online, then do 2 with your proctoring doctor at their facility. Then it's do 4 more at your own facility, and then you're more than excited and sometimes even able to, train other doctors because you really have seen, close to 16 cases before you're absolutely by yourself. So a lot of providers like, this is amazing. I mean, I'm set up for total success, and that's the goal of the program, and no one's developed one that comprehensive as we have.
So I got another question. It's a cool sculpting question. Cool Sculpting has seen some recent litigation. Does the company have any current pending lawsuits or anything that we should know about? It wasn't phrased that way.
No, that's a very great question. I love it. We have no pending lawsuits. We've never had any lawsuits with this product, and we feel very blessed with that. And probably some of the biggest benefits of it is obviously the less heat you put into a patient, the less risk for the provider and the patient. So that's number one. Number two, when you have an FDA approval of no BMI limitations, where we have a 2 to 5% guarantee, you can literally measure the patient before and measure the patient after, so there's no lawsuits associated with results, because these results are objective. And that's one thing I forgot to mention in the beginning. If you can't have your 5-year-old kid walk into a room and say which one is the before and which one's the after, if they can't tell objectively, then I always tell providers, please don't get involved with a company where the results are so minimal you have to have a microscope to see the results, because when patients are unhappy, that's where lawsuits start to fly. And we've been very blessed and fortunate, but there are no pending lawsuits whatsoever with sun sculpting.
The next question, is it made in China or is it made in South Korea?
No. No, that's a really great question. It's not, nothing on this is manufactured whatsoever in China or Asia. 80% of our manufacturing is in Germany. The other 20% is in Scottsdale and Tucson, Arizona.
Okay, well, that's rare.
Yeah, great question, though. I love it.
All right, and the next question, what would, this doesn't, I'll read it anyway. What would cause a doctor to fail?
Okay, that's a great question. So, and I'll be perfectly honest, this is open to interpretation, so now we're going off script. This is just more of a CEO's perspective. So we had a doctor who was an internist out of California, who we did our marketing program for the doctor, started rocking, got to about 12 cases. Now you can kind of do some math really quick out loud. If the average procedure is about $5,500, let's knock it down to $5,000 for math's sake. And let's just say $5,000 for treatment. So this doctor got to 12 cases a month. And when any doctor gets a machine, we say, what's your financial goal? Help us to understand your goals. Some doctors say 20 cases, some say 30, some say 60 a month. So we say, okay, great, here's what we're going to do. Here's the marketing plan. Here's how we're going to execute it. Well, this doctor actually said, my goal is to hit 80,000 a month. We were hitting 12,000, but the doctor wouldn't do any educational events, wouldn't do any of the other things on the backside. So I called the doctor and said, doctor, in my opinion, we're not hitting the goal. 60 is great. Your payment's only 4,000, so I know you're making good money, but I thought we were going to hit the 80. What's going on? And the doctor said, you know what, I'm not going to push it like that. You know what, I'm pretty happy doing 3 cases a month, and this is the type of money. I'm making more doing this than I did as an intern. I don't want to push it anymore. So, if you were to say, okay, is that a success story? It is on one aspect, but we want our physicians to hit whatever goal that they want. We've also had doctors say, you know what, I just want to do 1 case every Saturday, and I'm happy with an additional 20,000. So in my opinion, if your goal is 100,000, then we're going to keep pushing it until we hit it. We don't want to back off if that's the goal that you've set. Because all the marketing programs, now keep in mind, when we do a billboard, when we do Google AdWords, when we do Facebook boosting and direct marketing for you, we take it seriously. This is an investment. We want to hit those returns. And it's really based off that doctor's commitment. So if a doctor says, no, don't bother me anymore, we have enough leads coming through, we totally understand that, but we really take hitting those goals seriously. And that's why in the beginning, I've had doctors say, if I could hit 40,000 a month, I'll be so happy. And we hit 40,000 the first month, and we walk down the hallway, and the doctor puts her arm around me and says, I didn't want to tell you this, but I was so in trouble financially. I was hiding my car. It was getting repossessed. I just pulled my kids out of primary, out of their private schools and put them back into public. And this has changed my life. Thank you. I thought it was like maybe smoke and mirrors. But that's the value. When products finally match up, and it can get the high revenues that a physician truly deserves from their hard work and schooling, it finally allows them to go, whoa, this is what I got into it. Patients are excited. They're referring their friends. Their smiles. They're enjoying the very art of medicine. So I would think of, a failure is if someone doesn't hit their numbers. But if a doctor says, no, back off, I don't need to hit whatever number we originally planned on, then that's up to the providers. But that being said, that's the only time a provider. So
basically, you haven't had any real failures. Just somebody that's
we haven't.
making $8,000, not $50,000 a month.
Exactly. Yeah, we've never had a doctor.
I got 2 more questions, which are kind of important. One I'm going to answer. I read a disclaimer before. So for pricing information and lease and finance and all that kind of stuff, we do have to have an authorized representative call you. So if you email members at topdr.com, members at topdr.com.
Okay.
And then James, this is straight for you. They're asking, does this price include a marketing budget? So that the advertising you're talking about, is that extra money, the initial, or?
No, that's a really great question. So all of it's inclusive. So the system sells.
I was going to ask that question myself, actually.
Yeah, it sells for $250,000 in Europe. We sell it for basically $180,000 in the U.S. So doctors don't have to go through this negotiating. But the 6 months of marketing with the billboards, all the internet, Google, everything is all inclusive. All the training fees for the doctors, every instrument you need to do the procedure, like the cannulas and everything, all that's included. The only thing that's not included is you're traveling to the training centers, which is your hotel, your airfare, that type of stuff, but it's a turnkey solution. So the goal is not to go, oh, by the way, and here's a trick, here's another $60,000 we didn't tell you about, or what a lot of companies like to do is
one of your friends just texted me that you guys spend an average of $30,000 on that. Is that correct?
Yeah, exactly. That's exactly right. So we have leverage. So let me give you guys an example, because we're working with Lamar, some of the biggest billboard companies out there. If you went to them, they would charge you, let's say, $5,000, literally, and say, okay, it's $5,000 a month. We can leverage them because we're doing billboards throughout the nation for our clients. We can get that same billboard for, let's say, $2,000 or $2,500, depending upon the demand. We can use the remaining dollars for Google AdWords, Facebook, all those boosts that we plan on doing. But we always hit a trifecta, meaning we always do some type of external marketing. So we've had one city where they didn't have a billboard. Honestly, they're like, we don't even have a billboard. So we allocated more to local media like radio, and we did more on Facebook and Google. So we always do a trifecta approach, which means 3 different mediums. We don't believe in dumping everything into one medium until you tell us, hey, we're getting all of our calls from Facebook, or wherever you guys are giving us that information back, we'll plug more into it. Now, here's what we've discovered. By the time we get to month 3 and 4, our providers are well over the 4, 6, 8 procedures, and the referrals are so organic, and they continue to grow. And really, we all know how the numbers work. If 90% of all businesses fail really in that first 6 months, we do not want you guys to fail. We know physicians haven't oftentimes been taught what marketing works, what doesn't. And our goal is to make sure that you're following the successful track record that every other provider has done. And we're built for long-term relationships, not just, hey, let's sell the system and then run. Our goal is to say, all during that time, are we hitting your goals? How are things going? Numbers-wise, tell us what you're doing. We had one doctor who was in not a very good area and said, do you really think most of my patients are Medicaid, Medicare? And we've said we've never had a failure from Billings, Montana to LA to New York to wherever. But let's see how well it works in this area. And the business blew up. We did a billboard in Spanish. It drove so hard, we had over 22 procedures the first month. And the doctor's like, I thought you guys were out of your minds, but this is real. That same doctor, now has 6 of our systems and has other providers working directly for him doing procedures, because he was an interventional cardiologist and said, I just would rather be in a business where people like me. And that's his whole focus now. So
James, I have a question.
Yeah. Please.
So you're saying you pay for the marketing and the advertising, you get them going for the first, I believe it's 6 months, maybe correct me if I'm wrong.
That's right.
And then what happens if the doctor, because honestly, if I'm getting 4 new patients a month at $6,000 each, and it's costing me less than $5,000, I'm Dr. Joe, and I want to continue taking in all that money. I would prefer to pay that. Can they continue that advertising with you? Is there like a?
That's a great question. Perfect question. I love it. These are great questions.
I would think you'd have to be an idiot not to do it, but listen.
Exactly. We had a doctor in Casper who we got the program. He called up. They could only get the billboard for $4,000. We got it for $800. And at the end of 6 months, they were humming so well. And I said, your call. We can roll the contract at $800 directly to you. This is our true cost. We'll show you everything that we were paying. And the doctor's like, heck yes, I'm going to keep going with it, and continues to utilize that billboard. Remember, the more contracts you have, the more you can leverage them on negotiations, right? So if they think it's just a one person, they're not going to work really hard. And we also negotiate so hard with them that they want all that other business, because there's several billboard companies. Now, if someone has a billboard lockdown, let me give you an example. If they have a main way locked down and we can't negotiate with it, we get forced to go to another billboard. But oftentimes they'll say, "Whoa, this is a premier customer. We're going to bounce that customer that's been there for 6 months, and we have a lot more leverage than you would." So any of the marketing pieces, from the Facebook boosting ads on up to Google AdWords, because we're a bigger company, so instead of $50 per click, we get the same ranking for you being number one at $5 a click. So we could roll it in and say, "Look, here, you tell us the budget. Here's the budget after 6 months, and you manage your own account." But it should be all set up by then so that it's running seamlessly and you're seeing those revenues. Now, a lot of our doctors have said, "Look, I'm getting so many patient referrals. You know, I don't want to do the Google. Maybe not the Facebook, but I want the billboard." And that's fine too. You can carve out whatever you want at the end of 6 months. We've had some doctors say, "Hey, look, I've got enough referrals. I don't need the billboard or any of the others. I've got it down." And that's okay too. It doesn't offend us after the 6 months. We want reputable businesses to continue so that it's a joy to keep doing those procedures and to really finally reap the financial benefits that most of these devices in the past have hoped for.
I have another question, and there's more. We're going to probably have just this question and one more.
Sure.
However, so this question is a good one. How many of these devices are in med spas?
You know, that's a great question. So if you were to look at the number, it's probably about 30, maybe 25 to 30%. You'd be surprised. Most of our offices most of the devices go into regular medical providers' offices. We've even had them in urgent clinics. We've had them, you know, from OBs to internal medicines to, we've even had them at some of the bigger clinics that I won't mention because I haven't been given permission, where they pay a salary to the physician, and now they say, "Well, you can rent out a room on a Saturday if you want for $500, and the doctors do that as well. So about 25 to 30% are into med spas, and those are individuals that have done, you know, hair removal, photofacials, you know, some radio frequency, and are realizing they can't get past break even until they get a procedure like this. And then eventually
James,
they slowly start getting away from it.
James, I have one more question, and then the rest we'll answer by email, or we'll get back to you.
Sure.
This one is there a money-back guarantee?
Okay, so we're the only group that does a 30-day money-back guarantee. And what that means is we don't want anyone to say no. Actually, we do. We're the only manufacturer that has a full money-back guarantee. And the reason we do that is, if you were the one that didn't feel good about it, or it felt like it was falling apart, or you just had a bad feeling, we don't want you stuck with the technology in any way. And if it wasn't a good fit, we don't want you to be the first failure. So we do something that's unique. Yes, you have to purchase the system up front, but you really have 30 days to evaluate it. So once the system is delivered, you're treating family, friends, you're doing procedures, you're seeing if revenues are flowing. If for any reason you say, "I just don't feel good about this," there's a full refund at 30 days, no questions asked. There's no triple jump through a hoop to try and, you know, to get that refund. The goal is to say, did it work for you, doctor or provider? Did it make sense to you? Is everything we said as represented? And we've been very blessed. We've never had one provider fail. But I've told my providers alike, if you are the one, it doesn't mean it's a bad thing. It just means it wasn't a good fit. You don't need to learn a $180,000 lesson if for whatever reason it just wasn't a good fit.
There is one more question. It's an important one. So you mind if I ask it real quick? Okay.
No,
so is there a warranty? Is there an extended warranty? Can you buy an extended warranty? That's actually a very intelligent question.
Yeah. So it comes
what does it come with? Okay.
It comes with a 2-year warranty, and that's all technology upgrades. So if there's any software upgrades or internal handpiece upgrades or software upgrades, the reason we do that is we don't want anyone out there in the world using subpar technology. You know, we don't have a 6-month upgrade going, "Oh, we're going to upgrade them on this and charge them." Now, every year thereafter, if you say, "Hey, I want to sign a service contract," it's $5,000 for each additional year. What I tell most of my providers is, do me a favor, just mark down if you've had any service calls in the first 2 years. The benefit is you'll see how reliable the technology is. When things are manufactured in Germany, they have a high level of integrity where their reputation is everything and reliability is everything. So that's a huge benefit, right, when you have that type of guarantee. But if someone said, hey, I had, you know, more calls than I'd like on service, most of the time I tell our providers, just give it 2 years because you're covered under the first 2 years as a manufacturer's limited warranty, and that includes all the upgrades. And if you feel like there's any issues, then get the service warranty, which is $5,000 for each additional year. But most providers end up not even getting a service warranty because it's so reliable.
So we're going to have to, I would like to thank James Finnegan here for one of the best presentations I think we've had. However, so we're going to have to cut this off here because we're already at an hour. Now, the next thing I want to point out is Top Doctor has another webinar coming up, and while everybody is kind of on this COVID, either working or kind of working or waiting to work, this is a really unique opportunity. So it's complimentary. It is a company with a forensic auditor that's worked for Social Security, CMS for a couple of decades, and they will look at your billing for underbilling practices and more importantly, coding errors that can get you into trouble. They typically charge for this service, and I think they say $3,500, but they really charge $1,000. That's the sales thing. They're doing it for free during this whole crisis that's going on right now. So hoping to get you as a customer somewhere down the line, right? But this is a good time to take advantage of that. You can actually get in trouble for undercoding, even if you're getting paid less than if you did the correct coding and got paid more, or you may just be coding incorrectly or over coding, and you can get in trouble for that. So if you are taking any kind of insurance, I would suggest you get on that webinar, and you'll be able to ask live questions. And that is an actual former CMS forensic auditor. Of course, he does all the private insurance too, but the government payments are a little more scary as far as legal repercussions. And once again, if anybody has questions, email members@topdr.com. members@topdr.com. We're going to give James and his staff access to all those emails, so the right person can call you back with that can answer the correct questions. We can go over anything you want at that point. Once again, James, thank you so much. And
thank you so much.
I learned a lot.
Yeah, and
I mean, I thought I knew all about this stuff. I mean, I didn't absolutely the marketing part. I did not know you threw in the marketing. I did not know you can buy a piece of equipment like this and give it back. I didn't know any of that stuff. That makes me feel more confident talking about the equipment.